Water is vital for every living being on Earth. Only 3% of the water on Earth is fresh water, and about 2/3 of this is frozen in glaciers and polar ice caps. Most of the rest is in underground aquifers, and only a very small percentage is surface water. Throughout the world, many people don't have access to improved water sources or clean water. Over 2 billion people gained access to improved water sources from 1990 to 2010. Even so, more than 1/10 of the global population still relied on unimproved drinking water sources in 2010. More than 780 million people remain unserved. And waterborne diseases are one of the main causes of child death worldwide. Assuring people have access to clean fresh water becomes increasingly complicated during a humanitarian crisis. For example, in Haiti, this was proved on January 12, 2010, when a 7.0 magnitude earthquake struck the country and left it devastated. With 1.3 million people displaced, 97,294 houses destroyed, and 188,383 damaged, many thousands of Haitians had to resort to refugee camps to find some shelter. In the event of a humanitarian crisis involving a natural disaster, war or civil strife, food shortages or the collapse of basic services, and massive population displacement, developing countries are more fragile where they lack basic water and sanitation infrastructures. Crisis situations are generally divided into 3 phases: relief, early recovery, rehabilitation, and reconstruction. In these situations, priority actions focus on many different areas of intervention, such as protection, camp management, nutrition, and early recovery, and must also include providing safe, good quality water in adequate quantities. Ensuring excreta is properly contained and disposed of by making sanitation facilities accessible to and used by affected population. Establishing health services to detect and treat diseases, and promoting good hygiene, assuring the availability of the means to practice it, like providing soap, as well as hand washing and personal hygiene facilities, as part of the interventions in terms of water, sanitation and hygiene. But in some cases, it's difficult to have access to clean water, especially for poorer residents. And getting access to proper toilets and sanitation can also be difficult, leaving thousands of people to cope with an extremely unhealthy environment. One of the most common diseases that might be transmitted through poor quality water is diarrhea. Diarrhea is defined as having loose or watery stools at least 3 times per day. Acute cases can lead to significant fluid loss and dehydration, which may result in death or other severe consequences if fluids are not replaced. Most diarrhea-causing pathogens share a similar mode of transmission, from the stool of one person to the mouth of another. It's a leading cause of death during emergencies and natural disasters.
O calor e a umidade são ótimo meio de cultura. Eu quero dizer que grande parte dos agentes que possam ser infecciosos, os micro-organismos que possam ser infecciosos, têm muito mais facilidade em crescer e multiplicar-se nestas zonas do que nas zonas mais temperadas ou mais frias. Se nós acrescentarmos a este problema a desestabilização provocada por algum tipo de catástrofe social ou natural, e há um aspecto que é importante nos países que estão colocados nestes locais, que é a pobreza, vamos ter ainda cofatores de agravamento da possibilidade de transmissão de doenças através de águas e alimentos.
It's also more prevalent in the developing world due to the lack of safe drinking water, sanitation and hygiene, as well as poorer health and nutrition. Close to 2.5 billion people live without access to proper sanitation, and these unsanitary environments allow pathogens to spread more easily. 88% of diarrheal deaths worldwide are due to unsafe water, inadequate sanitation, and poor hygiene. Diarrhea is one of the leading contributors to child mortality, second to pneumonia. 2.5 billion cases of diarrhea occur in children under 5 years old every year, and close to 1.5 million children die from it annually. Cholera is an infectious disease transmitted by the bacterium Vibrio cholerae. There are various serogroups of this disease known, which means the same bacterium has, genetically, diverse forms.
Ela é transmitida através, obviamente, das fezes infectadas e como consegue ter algum grau de sobrevivência importante fora do organismo ou contaminar, uma vez que a diarreia da cólera é uma diarreia continuada, persistente, as pessoas estão sempre a eliminar a bactéria e, portanto, esta eliminação da bactéria ao contaminar roupas ou mesmo a pele da própria pessoa vai fazer com que seja muito mais fácil, através do próprio contacto, do contacto interpessoal, haver também passagem da bactéria para outras pessoas à volta. E, portanto, um componente importante para além da água contaminada, dos alimentos contaminados, é a transmissão de pessoa a pessoa desta bactéria.
Cholera continues to pose a serious public health problem among developing world populations which have no access to adequate water and sanitation resources. After the earthquake, Haitians faced a cholera outbreak, a disease they hadn't faced in over a century. As of November 2011, the outbreak claimed over 6,600 lives, sickened over 470,000 people, and continues to cause infections and deaths in Haiti.
There is also other type of bacteria and viruses that can cause the same symptomatology with cholera. Also rotavirus infection and E. coli infection.
Diarrhea can also be caused by rotavirus. It is estimated to cause about 40% of hospital admissions due to diarrhea among children under 5 worldwide.
Os rotavírus são os principais vírus que provocam diarreia em termos do grupo etário das crianças, sobretudo até aos 5 anos, e a nível mundial. A transmissão é feita pelas mesmas vias dos outros agentes de transmissão fecal-oral e a diarreia é uma diarreia aquosa. As crianças normalmente têm também vômitos e podem ter uma febre baixa.
Another pathogen responsible for many cases of diarrhea is E. coli. E. coli make up a large and diverse group of bacteria. Most E. coli strains are harmless, but others may cause diseases, in particular diarrhea, that can sometimes be bloody.
Algumas destas bactérias, sobretudo as Escherichia coli, podem ser invasivas. Quanto maior for a capacidade de invasão da bactéria, mais grave vai ser a doença que ela provoca.
In some cases, diarrhea can last for weeks. For someone who has a weakened immune system, chronic diarrhea may represent a life-threatening illness. Chronic diarrhea can have many different causes. HIV patients, for example, commonly suffer from chronic diarrhea, which results in significant mortality and reduced quality of life. In developing countries, nearly 100% of patients with AIDS report diarrhea. Another cause of chronic diarrhea is poor nutrition. In Haiti, for example, prior to the earthquake, about 1 in 3 children under 5 years old were estimated to be malnourished, and 1 in 20 suffered from acute malnutrition. Poor nutritional status makes children more vulnerable to infections like acute diarrhea. The persistent diarrhea results in poor nutrient absorption and weight loss, creating a dangerous vicious cycle. Bacilli of the genus Shigella are the most common cause of dysentery, resulting in bloody diarrhea. In the aftermath of an emergency, with a shortage of clean water and sanitation, it is indispensable that diagnosis of disease is quick and accurate. The life of a patient may depend on the accuracy of the diagnosis and the following treatment. The step following diagnosis is treatment. The primary goal of treating any form of diarrhea, viral, bacterial, parasitic or non-infectious, is preventing dehydration, or appropriately rehydrating patients with dehydration.
O principal problema da diarreia é a desidratação. É a perda de líquidos pelas fezes durante as várias evacuações que as pessoas vão tendo. E quanto mais grave a diarreia, maior é o risco de desidratação. Por isso, o tratamento da diarreia é, sobretudo, a reidratação. É ao impedir que as pessoas se desidratem. Digamos que se podia dizer que o tratamento da diarreia é a reidratação, seguido da reidratação e completado com a reidratação. De tal maneira é tão importante esta noção.
In the case of cholera, timely case management can reduce mortality to less than 1%. Mild and moderate cases can be treated with oral rehydration salts only. ORS can successfully treat 80% of cholera patients, both adults and children. The remaining 20% of severe cases will need rehydration with intravenous fluids. Antibiotics are not paramount in the successful treatment of patients. But they can reduce the duration of disease and diminish the volume of rehydration fluids needed, as well as shorten the duration of shedding of the germ. Doctors working, for example, in Haiti, are constantly looking for and implementing solutions to avoid the propagation of diarrheal diseases, especially in children. Some of the best preventive methods include the promotion of breastfeeding, vitamin A supplementation, and immunization against rotavirus, one of the many causes of diarrhea. Hygiene promotion has been a key component in keeping waterborne diseases at bay in camps. There have been many campaigns that aim to change behavior through community involvement, education, and health promotion activities. Promotions of hand washing with soap, for example, as well as community-wide sanitation, have been two essential preventive measures. Hand washing with soap has been shown to reduce the incidence of diarrheal disease by over 40%. Special teams have reached thousands of people through interpersonal hygiene promotion sessions, as well as through monitoring and promoting the proper treatment of water. Information on health risk reduction through improved hygiene practices must also be provided. In order to support the medical and social efforts and to effectively improve sanitary conditions, proper sanitation and water need to be made available to the people. Properly containing and disposing of excreta can greatly reduce water contamination and contribute to decreasing the transmission of diarrhea. As for water, people need to have access to improved water sources, like piped water, boreholes, or protected dug wells and springs, and should adopt and use methods of water purification, like chlorination, filtration, or boiling. Because sometimes improved water sources don't necessarily mean clean water. Interventions to improve water quality at the source treatment of household water and safe storage systems contribute to reducing the incidence of diarrhea by 47%. In an emergency setting, it's important for organizations to coordinate with locals and turn populations into actors in their own assistance. As former residents depart from the camps to return to their original neighborhoods, knowledge promoted by different organizations goes with them.
Eu diria que a base para a abordagem do problema será a redução da pobreza. Se nós conseguirmos eliminar os focos de deficiência do ponto de vista do acesso das pessoas a estes alimentos e a esta água, e portanto conseguirmos melhorar a qualidade de vida destas pessoas do ponto de vista quer económico, quer cultural, muitos destes elementos são também elementos de base cultural, vamos contribuir para que depois todos os processos técnicos que sejam necessários fazer sejam mais fáceis, não só de implementar, mas sobretudo de manter.
In the case of Haiti, the country's water and sanitation infrastructures need long-term sustainable efforts supported by Haitian authorities in cooperation with international agencies.
Reduzir a pobreza como base do problema e depois todas as medidas técnicas, não só ligadas à purificação da água, mas também aos aspectos culturais das pessoas que vivem nesta zona, com um aspecto extremamente importante que é o da educação para a saúde destas populações.
Educating empowered communities and providing them with the skill to build wells and water tanks, use chlorinators and implement hygiene practices is essential. Monitoring water quality during a humanitarian crisis helps to guarantee populations are consuming safe water. Reducing water-related diseases, providing education for health, and improving the availability of basic services will have a positive effect on any humanitarian crisis, promoting education and economic development, and improving the population's quality of life.